we want to not only understand how is that pelvic floor, but we actually want to understand how are your habits. So for instance, are you having enough water? How is your bowel health? How is your sexual health? Well, how is your sexual health habit?
Today we're talking with Aline Phillip, who's a pelvic floor physiotherapist based in Sydney, Australia. Thanks so much for making the time to talk with us today.
Thank you, Melissa. Thank you for the invitation. It's a pleasure.
Of course. Maybe you can tell us a bit more about your background and your specialty.
So I'm a pelvic physiotherapist, pelvic floor physiotherapist. So this means that I've done the whole license, like a bachelor degree in physiotherapy. So I've done my bachelor in Portugal. Then I did my postgrad diploma in Portugal in pelvic floor physiotherapy, excuse me. So then I came to Australia and I did also my master's at Curtin University. And that's pretty much it.
Yeah. Awesome. Well, thanks for lending your expertise. We collected a lot of questions from our audience, so I think we can just jump straight in. So what type of physical therapist would usually be the right one for someone to see if they have chronic or recurrent UTI?
So when we're talking about chronic UTI, we usually want a pelvic floor physiotherapist that is really trained in pelvic floor physiotherapy. And when I say this, it's because it's almost like there are two types of physiotherapists. Physiotherapists that are interested in the area, and there are physiotherapists that were really trained in the area and pretty much mainly do that pelvic floor physiotherapy. So it's a big difference. And when you're looking for the pelvic floor physiotherapist, you have to really ask, have you been trained in internal assessments? Do you understand the difference? Are you really trained in pretty much like trying to understand the conditions in the pelvis? Because it's quite different. There are some physiotherapists that have interest in pelvic physiotherapy and in conditions in the pelvic area. However, they usually only do it externally. They may use the ultrasound or not, but the type of education is really different. So I would say that assure that they usually have to have a postgrad or at least vast experience and training in pelvic floor physiotherapy.
Okay, that's really helpful. So what does physical therapy for the pelvic floor usually entail?
Several things. So I think I really love that you asked this question, because what I really like to always clarify is that pelvic floor physiotherapy is not only trigger points. And when I say trigger points, it's like internal massage. There's actually a lot more than we do. So particularly when we have a recurrent UTI, we want to not only understand how is that pelvic floor, but we actually want to understand how are your habits. So for instance, are you having enough water? Are you going to the bathroom the right number of times for the water that you are having? How is your bowel health? How is your sexual health? Well, how is your sexual health habits? Do you go to the bathroom before you have intercourse, penetrative intercourse, or do you go after? How are your hygiene habits? Because often what I see in my people that have recurrent UTIs, it's not that they actually don't have good hygiene. It's usually they overdo it. So they usually use a lot of soaps, and they use a lot of things that can irritate the vulva or the vulva mucosa in the skin of the vulva and the vaginal canal. So also it's important to ask, like, do you clean on the outside or do you also clean on the inside? And I do have some of my patients that do have the habit of cleaning inside. And we do know that the vaginal canal, it's supposed to be well, it cleans itself. It's a beautiful area of our body that was designed to clean itself. So it's always really important to assure like hygiene habits, and also what do we eat? Are you eating well enough? Are you sleeping well enough? Because we do know that eating and exercising and sleeping, they actually will have an impact not only in your vaginal health, but in your overall health. So it's important to really cover a wide, like it's not only pelvic floor. And I think this is really important to clear. And it's definitely not only massage. We can use our hands, we can use machines, we don't even need to make it invasive if it doesn't have to.
That was the next question. Does it have to involve internal work? I think some people would like to know more about what that is, for one thing, and whether they can opt for something else if they're not comfortable with that.
And I love that question, because the fact is not only women have UTIs, and not only women have probably I should not have to said women, more like female designated at birth. So those that have a vulva have problems with UTIs, but not only them. We also have kids, we also have men. So for kids and male designated pelvis, we actually don't do an internal usually, which means that there are other things we can do. So like I was saying, the habits will give us a lot of information. And we also have little machines called biofeedbacks, which I'm a quite big fan of, which are pretty much like, imagine like little electrodes that you put on the outside of your pelvic floor, and then we have like a little screen. And when you're contracting, those lights go up. When you're relaxing, those lights go down. So it actually gives us a really good idea of what you're doing without having to go internally. And the reason why I think this is so important to acknowledge is because, unfortunately, we do know that trauma is quite, it happens to a lot of our population, not only child abuse, but also in adults. And not often, or it doesn't even need to be with like sexual abuse. It can also be trauma in a health context. So I always like to give everyone an option to choose. And I do think it's important that if you don't want to have an internal assessment, just let your physio know, and your physio should just provide you an option.
Okay, and what is an internal assessment? Can you describe that in more detail?
Yes, of course. Unfortunately, I don't have my pelvis here, but I'll try to just explain a little bit. So before we even go into the internal assessment, I'll just explain a little bit of where is the pelvic floor, and I'm pretty sure you already have an idea, particularly you, but your people that are listening. So if you're looking on, we put our hands around our waist, we find the top of our pelvis. Then if we walk forward, we find the pubic bone. And then on the back, we found the sacrum, which is the end of your spine. And connecting the pubic bone into the end of your spine, the sacrum, is the pelvic floor. So your pelvic floor is like a little ball that connects the front, the back, and the hips. And because it has so many beautiful functions, has the function of continence that we all know. So a good pelvic floor has to be able to squeeze and relax. So those are two things that I want to make sure that I'm checking on a pelvic floor assessment. I want to make sure that I can see the pelvic floor squeezing and lifting. And as it relaxes, it has to be able to open and descend a little bit. So first, it's a function of continence. So the second function is the function of sexual function. So a good pelvic floor has to be able to relax, to allow for a sex toy or a penis to go through, or whatever you would like, or a digit or a tampon as well. But in order to, but another function of your pelvic floor is the function of like to increase pleasure. So because of the location of the clitoris, a good pelvic floor has to be able to also rhythmically create some contract and relax action in order to stimulate the clitoris and hopefully, ideally, but not to everyone, reach an orgasm. So it's really important for that as well. Third function is the function of support. Because of the area where it is, we are there pretty much like holding the organs at the top. So we have the bladder at the front, the urethra, then we have the vaginal canal and the uterus can be like that and like that. It's just very anatomical variation. Then we have the bowel on the back. So your pelvic floor will be also influenced by those three organs. So why do I have to explain all of this? Simply because when we're talking about an assessment, this is pretty much what we're trying to understand. So the first thing we do is we look on the outside. So what we want to understand is how healthy are your tissues. And the reason why this is so important is, for instance, let us imagine that you have the person that I'm assessing has a lot of, even before I see her, she tells me that there is a big history of allergies. And when I check the pelvic floor, there's a little bit of like redness. Redness usually can be either an infection, but it can also be something like dermatitis. That usually means that there is some areas of the skin are a little bit more sensitized, and it can be sensitized, or they can also be a easy way for bacteria to go in. So if you have repeated episodes of UTI and you also have dermatitis, I would like to make sure that dermatitis is also controlled in order for us to also control the rest, because we want to make sure that the skin is really healthy. So we have like a sealed, we are sealing the outside and the inside, the outside and the inside. So we also want to check not only the skin around the entrance, but also around the clitoris and along the labia. So we want to just check how the skin is. Is it all uniform? Are the glands all completely normal? And that's pretty much like on the outside. Then we want to also from the outside, we want to make sure that we already can see that your pelvic floor can squeeze and relax. And what we see is that when you contract, it closes and lifts. When you relax, it opens and drops a little bit. And that's pretty much on the outside. So if you have a history of pain, there are sometimes some what we call a cotton tip tests. Then we usually imagine this is a cotton tip and imagine this is the vaginal entrance. So on the outside, what we do, we can just do that. And it's not supposed to hurt. And actually, no pelvic floor assessment should be painful. If it is painful, you have to let your pelvic floor physiotherapist know. It's not supposed to be. It's just supposed to be about control. So when we do this, all we want to understand is, does the right, it feels the same as the left, and how much pain are you feeling? If you're feeling a lot of pain, even with a cotton tip, sometimes this is more than enough, and all your physiotherapist needs to know is that that was enough. You don't have to do the whole assessment in one go. But if everything is fine, we usually move internally. Internally, usually we can do it either 1 digit or 2. Particularly with people that have a lot of pain, we usually only use 1. And it doesn't, like I said, it's not supposed to be painful. So what we do is we very carefully, well, of course, we have a glove and we use a lot of loop. So what we want to do is we want to just go very gently internally, and we want to check all the muscles from the external to the internal. So there are muscles on the outside and there are muscles on the inside. And what your pelvic physiotherapist will do is it will swipe a little bit the muscle on one side and the other, and it will ask you, does it hurt? And it will move on into all the little muscles. It will always ask, like, does one feel the same as the other? Does it hurt? Does it feel okay? And then after checking all the sensitivity of all muscles, your pelvic floor physiotherapist will ask you to just squeeze and relax again, because it's different from seeing on the outside than inside. Because on the outside, your muscles close usually like a O in a way, but internally our pelvic floor lifts, so it's like a U shape internally, so it lifts and narrow at the front. So the action is quite different on the outside and inside. So usually what we want to understand is, are you actually able to completely squeeze and support the bladder, and are you able to also let go of the posterior or the back part of your pelvic floor and open and relax the front as well. But those things are really important, particularly when you're doing a wee, for instance. So if you're doing a wee and you're just sitting, we want to make sure that you're actually, I feel like pelvic floor physiotherapists are really adamant of we really like to emphasize the importance of how you do your wees and your number twos. So particularly because it will tell us a lot about how you're actually using your pelvic floor to empty your bowel and your bladder. So by asking you to relax during an assessment, what we want to make sure is, for instance, when you're doing number two and when you're doing a wee, are you actually relaxing your pelvic floor, or are you doing a semi-relaxation? Because if you're not completely relaxing your pelvic floor when you're doing a wee or when you're doing a number two, usually it's easier to leave a little bit behind. If you are leaving a little bit behind, you will increase your chances of having a UTI. So it's always important that you are really completely relaxing, but when you're also able to, of course, contract your pelvic floor to stop us from leaking when you cough, laugh, and sneeze in during activity, of course. And after doing that, we usually, after checking all the function of your contractions of your pelvic floor, and we usually do a little bit of strength test if your problem is lack of coordination or strength. So, when like the last part of the assessment is usually what we call a POPQ. So the POPQ is just the way that we usually assess for pelvic organ prolapse. So as you've probably noticed, I have a spoon here. We don't use spoons during our assessment. We usually use a tongue depressor, but I didn't have one at home, so I'm sorry for that. So I want you to imagine this is a tongue depressor. We usually either use a tongue depressor or our finger to create support. I do like to use my tongue depressors a little bit better because they give me more. I can see better. So what we usually do is we put a glove around or a condom around the tongue depressor, and I want you to imagine this is the vaginal canal. And what we do is we insert very gently on the back part of your like the down part of your pelvic floor. We put a little bit of pressure, and we usually ask everyone to bear down. So what do we mean with bearing down is like pushing the tummy out. And what we want to understand is, if I'm supporting the posterior or the down part of your vaginal canal, and you bear down, is there any movement coming from the anterior wall or your bladder? And if there isn't, great. And we usually ask you to just bear down and hold for 6 seconds. Then what we do is we support the anterior wall, and we ask you to do again the same. And what we want to understand is when you bear down, is there any movement from the back wall? So we want to understand how is the support from the back part of your vaginal canal. Now what we have to do is we remove the tongue depressor, put it to the side, we use our finger if it's comfortable, and we go all the way into the uterus, so the cervix, that's where we are touching. And then we ask you to do pretty much the same when we ask you to bear down. What we want to understand is as you bear down, is the cervix descending? And then we want to understand, as the cervix is descending, is it pushing the walls to the side? The reason why checking for prolapse is so important when we have a UTI, it's because if we have an anterior wall prolapse or a bladder prolapse, I don't like to call it bladder prolapse because it's not the problem of the poor bladder, it's the anterior wall that is actually descending. So when we talk about an anterior wall prolapse, it's almost like the support of the urethra is a little bit impaired. So what happens is as it descends, the bladder, the urethra can actually become kinked. If it becomes kinked, this is when my people say, I have to strain to start the wee, or I have to strain at the end. And that already tells me that probably that urethra is kinky. It will be more likely for you to leave some wee behind. So that's why we usually check for those things. And that's pretty much it. Not all pelvic physiotherapists will check for everything because it has to be relevant for your symptoms. So for instance, if you've never had a baby, that is probably you're not going to have pelvic organ prolapse. You can actually still have, particularly if you have EDS and hypermobility syndromes. However, it will all depend on your symptoms. So people that have pain will probably, your physio should do the Q-tip test. If you've never had pain, most likely you will not be done that.